Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society. And I've got a case here today that I think ought to be studied by anybody that has some authority in what is taught in the United States and all over the world about orthodontics and surgery in orthodontics. In this case, I think could prevent, if we did many of the surgical cases instead of going through all this upper and lower surgery, which is a terrible amount of surgery. I have scrubbed in with the surgeons, and we worked on somebody from 7 in the morning to 1 o'clock that day doing upper surgery and surgery of the lower jaw and advancing it and the genioplasty. And I wonder how God can heal that person up and but it does amazing things in healing this and treating this people that would do the surgery. It's wonderful surgery stuff, but it's not necessary to do a lot of it. In this case, and I've got a whole string of these cases where we took the lower 6-year molars out and they had second molars, and we pulled the back teeth forward, the lower anterior teeth back, simply by pulling the upper teeth forward. Many of the orthodontic cases need the upper teeth brought out like that, and you can put pins in this and hold it and pull on the upper teeth, and you can bring the upper teeth out wherever you want them without the orthodontic surgery. And then you can bring this space together by pulling the back teeth up and closing it. But you need the space to do it with. And so this is complicated surgery. But I've got a lady here that we started, and it's about 37 years ago, and it is still looking excellent. And I saw her just recently. They took some pictures of her. I didn't get to see her myself, but she's still there, just as good as it was the day we finished it. So I'm going to start out here and try to go through this. I've got thousands of seem like pictures on her over the years. And so she's class 3. There's no question about it. You can look at the jaw. You can look at the jaw coming out here. This is 1987 right here. And we got from 87 to 2000, and then from 2000 to 2024. So there's 24 years plus look like about 13 years here in this area. And here are the teeth back when we started working on her. She's got not a tremendous class 3, but it is definitely a class 3. I'll get up and you can look at the models here. The upper teeth are fitting inside the lower teeth. The lower teeth are out in front here. They're more edge to edge. Over on this side, the center line is off a good bit up here. And we're going to treat this case by taking out lower 6-year molars back here in the back. Now let me get over it on the side. So you take this tooth out. She had periodontal problems. Now the force that we're going to bring all these teeth back, both sides now. Think about it in the whole thing, not just a flat thing. So we're pulling these back by pulling these teeth forward up here. If you wanted to pull them more forward, you could put a pin in this area right here and pull on this, and this wouldn't move much, and you would move this forward up here, and that would save you from having to go up and cut this all loose. If you could scrub in on some of this surgery, I remember scrubbing it in, and I helped them tie the maxilla back up, And the old surgeon who worked, he came to my office and worked on these cases a lot of times. And he says, "How does this look to you, Bill?" And I looked at the man and I said, "Don't ask me. I'm over here praying that the lady's going to live through this thing." And she did, and she changed her whole life. You know, the surgery was marvelous to know how to do it. But it can be avoided, much of this surgery. Now, so he took these teeth out. So we pull these forward and pull this backward. And then when you get these teeth out where you want them, stop pulling on them. And now we'll bring the back teeth up, the wisdom tooth, the second molar, and close this. And I'll pull this to where these were sitting in here, and the lower teeth came out to this area right here. And that is the way we finish this case up. Now, take this case and take it to the dental schools, the old surgery departments. Go over it and study this case. And if I'm not right on this case, let me know what's wrong, and I'll think it out too. But I don't think I'm wrong on this case. You can prevent a whole slew of upper jaw surgeries doing some of these cases. Now, some of the cases got too much vertical and all sorts of things that are wrong, have to be done by surgery. But there's a whole of a lot of it that doesn't have to be done with surgery. And this is the type that is. So study this case. I don't care. Take it to the dental schools all over this country and study this case. And the lady's still alive. She's a very nice lady. She's an airline stewardess. And I saw her. I have some pictures of her. They sent me, a friend that knows her, sent me the pictures of her. Well, let's show you what we did. I'm going to try to go as fast as I can. I've gone through this so many times, you can go study it. So we took out the 6-year molars on the bottom now, but not the top. Now this is an 040 wire in here. All right, down here we rotated this tooth. We had to turn it, and it's almost impossible to rotate a lower anterior unless you can get the root moved in. The crown of it is like this, and the root is opposite. And you turn it around, you pull that root into that thin area, and it's going to strip off some of the tissue from that. So here we're going to take these out, and then we're going to pull this back part of the way and stop and hold it there and put pins. We didn't put any pins in this, I didn't need to. And then we bring these teeth forward, and to bring these teeth forward, we'd also, we would pull that where that would help move the upper teeth to the front. All right, here it is. Now, we are coming off of here with elastics, and see, it'll pull this area forward right here. Then you can nail this down, or if you needed more room up above, you put pins or screws in here to hold this. Don't let it go back any further. And then we pull this up to here and pull this out, and we use this anchorage point here to bring this forward, and this close up to this space right here, and I'll show you what it looks like. All right, we go through this. This is 1987. All right, here, she's even got a periodontal problem. If she'd have been a smoker, I would have never started this case. And she's age 24 and 7 at this time, and the time was 1987 when we started. So there's 3 years to 90, 10 years, so that's 13 years. You would, from 90 to 100, right in there. So it's that 13 years plus 24 years. This time that this goes. and this is held in shape the same way that you do any of it. I can show you how to do class 3 retention and not let the things go to pot. Okay, so these teeth had fillings in them. We took them out like that. All right, we're going the wrong way. All right, here we pull this back. We pull these teeth forward and these teeth back to join them here. And I didn't need to put pins in them. I could have done that and held them there and pulled the upper teeth further forward if I'd wanted to. All right, this is 1988, and we slowed down because the bone structure of these had periodontal problems, was giving a little trouble. So here we're tugging on this and coming together. And you can see now we've got that pretty much together, and that leaves the molars back here hanging off the back. You know, I leave them there because you want whatever force you can to keep these teeth as far forward as we can do it, like that. So we left them alone. Now we've pretty well finished this up at age 28 and 7. We've got this space closed. We've brought these teeth forward here and put them into a class 1 relation, you see, right in here. Take this case and study it any way you want to. Go to AI and you study it. If this is correct, then this ought to be used all over the world to learn how to do class 3 corrections in many, many cases without doing the surgery. This orthodontic surgery where they cut this loose up here, they trim this sinus away, suture it back, and it grows back, and God knows how on earth it can go back like the way, but it does. I've scrubbed in, I've seen them. I've seen the people after you get through with it, they look so much better. Their kids didn't even hardly know them. And it is wonderful to do that if you have to do it. So maybe we got to learn how to do it by doing some of it where it wasn't necessary. Now this is a periodontally involved tooth, but she took care of the periodontal. She did not smoke. If I told her if she had been a smoker, I wouldn't have taken it, because they got a periodontal defect in there, genetic growing, and in the family she's in, they had that problem. All right, we went in, pushed. I'm going to show you all these slides just for the heck of it. And here she is down the line a little way. We're part of the way through there. And now turning this tooth around, we had, it's going to, the broad part of the root's coming out here, and this will cut through the tissue. I don't care, you can't get onto something up here and torque the root in. There, you couldn't do that. All right, here the upper now is coming forward, and we're pulling this back here and bringing this together. And if we needed more anterior upper teeth brought forward, you'd put pins in this, pull it back till you make room enough, and you'd put your pins in there to stop that, and then pull this forward. You'd have to pull this with, you'd have to pull this to keep this from coming back. You'd pull this again, and then pull the upper teeth forward on these teeth right in this part of the mouth, and you can advance it. Now we had to expand the upper arch, and so to get it, we use one of these large arch wires. We put it in like that. That's a poor picture, but we can expand anything walking and breathing with this. If you bring this upper jaw out, you've got to set it over the lower jaw. So we'd have to bring it out some to do that. And that's where we use a large arch wire to do that. Some people ought to learn how, if you want to torque these teeth out, you got to learn how to put a rectangular wire in underneath this and put some buccal root torque to bring these teeth out at the buccal area, so that when you get them there, they're out there, they're not leaned this way. So I'll show that in use of this Big Daddy arch wire. Now we were using the plastic brackets on this upper, and there it is, and we widen this part up here to put these upper teeth over the lower teeth. Now we're pulling this, and we'll close that together. We finally got this turned, but we went through the tissue. These teeth are flat in this direction, and the crown is flat in this direction. We turned it around and got it in there. But we had, now we get it here, we'll torque the root in, but your attachment doesn't work out quite that way. All right, here we're closing this gap. Now this is 1988. We've been in there quite a while working on this case. 1988, it was 1987, I think, when we started. And here it is, 8/8/98. All right, the lady gains a few pounds in here, and you can see it. But she goes in and loses this weight again. Now we're bringing these teeth forward. We put a lip bumper in here. You have to run interference for it. Now if you're bringing these teeth out like this, you run interference and you keep some soft vascular tissue space in between this, and the roots of the teeth can come out. But if you let the gums or pull tight against them here, you'd run the teeth through the bone. You don't want to do that for sure. And we had to torque them out a little bit as we brought them forward. And so you put a lip bumper in. So this is a lip bumper made out of a regular arch wire with an angle to it so it fits over the tissue. And the tissue never gets to the lip bumper. You expand this out right here. Now you've got to learn how to do that too. If you're going to do these surgical cases that normally, she had been to 2 or 3 surgeries and talked to them, and they were going to do that type of surgery. She came to me and I said, I think we can do this without surgery. And so we did it. And it's been 37 or something years ago. And her teeth are still in place. So you got the lip bumper. This thing has been expanded a lot, keeping this out in front as these teeth came to the front. Take it and do this. Look it over. If it is not true, tell me about it. If it is true, it ought to change the way surgery is done on many, many people's teeth. And the insurance companies, this type of surgery is extremely expensive to do it. And if you can do it without the surgery, why don't we learn to do it? If you're the insurance company paying the price to get this out there, or whoever pays, I don't care who it is. Now we know how to do it, and we do it in cases that really need that, and this would not work on them, but this works. And I hadn't got much longer to be around in this country, and so I'm 96 years old now, and I had done this years ago, and it was good then. I've lectured on it throughout the country, and actually all over the country and in many countries in the world, but had little effect on people doing it. And so take it and study this case, whatever it is. If I am right, it means a lot of people coming in here getting their teeth. you got something to bring these teeth out in right there. Now we got the space together over here. This is all lined up. And this is, here it is, 40, I don't know the date. We've got that lip bumper she wore. And somebody looked, I've had only one person wrote back and says, you shoved the teeth through the bone. The person didn't even look at the case. Normally it would have, but I had a lip bumper in there. And the lip bumper ran an interference with these, and you carried a soft vascular bed, and the bone will go out with the teeth. It'll go out there with the teeth. And you don't run the roots of those teeth through the bone, bringing them forward. So this is your upper jaw surgery, and we did the lower jaw surgery. The whole thing is done without any surgery in here. There we go. This is 1990. All right, here we've finished this out up above. We put a retainer in there. We hold her out there. These roots have bone over them because I put this lip bumper and it ran interference from it. And any of you out there can use a lip bumper. I made the own lip bumper out of a piece of arch wire and then made the angle so the lip bumper was not straight up down. It was just like the tissue. And I kept the tissue out away from this lip bumper. The lip bumper ran the interference for it. And the roots of the teeth came out with the teeth. It came out, and they didn't come through the bone. There is bone on those teeth. And so this has happened, and it is held up for 37 years. And I saw her, or somebody sent me a picture. She came to town here in Glenrose. It is amazing. Now here it is, 91. We finished it out this way. Now looks like that. She has no class 3 appearance at all. This is 87 to 91. So I worked on her 3 years or maybe 3.5 years. This has been out for a while over here. There it was in 91. And we started, was in a crossback. We expanded the arch with a big daddy arch wire and brought it out, and you have to learn how to bring the roots of the teeth out parallel to make the airway correct. The upper wisdom tooth is just hanging on the back, but I didn't take it out because I want all the force keeping this forward I can get. Now there it is in 91. And we expanded that 40 millimeters there. This tooth was like that. Look at it now. Here she is. I don't have the date of this picture, but this was a few years ago. She had been out, I don't know, maybe 20 years at the time I took this picture. And she needs to get it, somebody to scale it. This is coming through these. He brushes the heck out of them and everything. And the bone's thin over there, but it's there. It's staying there. And then I should find that picture somebody sent me of her. And look at the class 1 relationship in there. Now, if I am right here, then you guys that are doing the research and everything to see if this holds water, do whatever it is necessary. And if AI comes in and they want to show this as how to do it, I think this is the way to do it. It is better than the surgery. If you can get this to do this good, why do the surgery? She has been that way for 37 years. And I haven't got a lot of time to be around here to argue with people about it, but it ought to be checked out, and if this is true, it ought to be spread all over the world to save this surgery. If the insurance companies that pays to do this double saw surgeries right now, if you just look at the hospital, and I remember we worked on this lady from 7 in the morning till 1 o'clock doing upper jaw, lower jaw, and a genioplasty on her. And she looked so much better, her kids didn't even know who she was, and her neighbor didn't know it. And that is wonderful. We can do that, but it is not necessary to do, and many, many people would go ahead and do it if they thought they didn't have to go through that surgery and didn't have the $50,000 or $60,000 it costs you to do that. So here we are doing that, and it stayed out there. Now, watch this part here. We brought these teeth back, and we didn't lean them back, we brought them back. Look at the pagonians on the tooth right there. Look at that. Now I'm going to come in. Now I told her when we did this, you might have to go and do a genioplasty and bring this back, but we didn't have to. Now we've got that tooth. This tooth is hanging off the back, but I'm leaving it there just to support this anterior part of the teeth. And here it is at 887, and this is January 7 and 10, 2010. It looks like it slipped out of position here to some extent, and it may have lost some of it, but it's looking good. And this was 10, 87 to 10. So that's 13 and 10, 23 years later here, and now it's 37. And I saw this picture of her the other day, and she looks just as good. Now, here was the pagoda when we started. Look at it. We moved those teeth back that far, and we moved the upper teeth forward, and we used a lip bumper to bring those upper teeth out. They're not tilt way out there. We brought the roots and everything out. By bringing this back, we would pull this out. And you need to bring this further, you put a pin in here. Now, check it out. I don't care if you can find something wrong with it, go ahead. I'm ready to take it. But I think this is the truth, and this is the thing that ought to be done. And as AI can put about your artificial truth, this is a fact. It's not artificial. It is a fact, and it works. And this ought to be taught all over the blooming world. Instead of doing the surgery, I'm sorry to take the surgery that much away. I've put on table clinics, and surgeons come up to me and said, well, what are we going to do if you take this away? There's a lot of other stuff that can be done with the surgery. Here is this woman. This is 23 years or something after we started. This 87, and this is as good a profile as you can get. And now she sent a picture to me. Well, the friend that took the picture sent it to me, and I don't have to show it to you. But that's another 14 years. It's still there. Looking at it from the front. No sign of class 3. She's still got all of her teeth, even though she had periodontal trouble, but she's not a smoker. And it worked. And there's his teeth. Study this case. I want it to go to universities that's going to do some research, everything. If I'm wrong, tell me I'm wrong, and I'll think about it. You tell me why it's wrong. Don't just say it's wrong, because I'll think the cotton picking thing through from start to finish. and it's correct, and I'll stand on that. And I'll pass on. I'm sorry to leave this world, but this is something that ought to be looked into, and this would save numerous surgeries, and people could have this done, and many people around over the world that are class 3 could have this done without the surgery. So I'm going to leave it that way, and if you don't believe it, I'm sorry. And if you're a researcher, find out if I'm true. And if I'm not true, tell me, but don't tell me it's just wrong. Tell me why it's wrong, and then I'll check it out myself. And if it's not right, I'll tell you too. And this is a ridiculous thing that we're doing. And another ridiculous thing that the orthodontists are doing, they are not letting the pediatric dentists study orthodontics at school. They won't even let the AOS come to their annual meeting to teach the pediatric dentists. And I have taught I don't know how many pediatric dentists during my lifetime. And I wish that Roy Wolf with St. Louis was still alive. He didn't put up with any of this junk about not training the pediatric dentists orthodontics, that they don't have sense enough to do. They should be doing orthodontics. And every dentist ought to know orthodontics. And they ought to know something about the temporomandibular joint. And that is the true fact. And I put that out for AI. If you want to come in here and AI is something that's changing the whole plot and picket world, you can get answers to stuff in seconds coming in. And they ought to tell the true answer. I don't care if you use my stuff, just put my name on there that I came up with it. So I'm going to leave that with you. And I hope that somebody in some university or wherever it is that does research, look into this. This works, and you should know about it. I've got a whole string of cases that I did by taking out the 6-year molars down on the bottom. At first, people thought I was crazy as hell, and for even asking to do that. But I sat down with the people and showed them what it was, and they said, we want to do it. And so I asked the person that sent the person to me, he said, I'm not having anything to do with it. I said, well, you mind if I have an oral surgeon take the teeth out, and I'll do it. And they did, and it worked out perfect for them. And I kept seeing this guy at dental meetings. I say, how's our patient doing? And he had to come across finally and realize that it did work. And it does work today. And I've been using it for years. And I want it to be spread out to the world. And I haven't got long to do it. So I want somebody to get with it now and do it. So I'm going to say goodbye and thank you for watching, and join our channel. We've got 3 YouTube channels. Thank God for YouTube. Came along just as I was retiring, and I have put this out all over the world, and I'll still do it till my dying day if the Lord wills. So I'm going to hang up.